the system is complex. So because it is complex, we have to give very, very close attention to the context. Okay? And we know there are already evidence available to show what improves care. So one of it is to develop optimal care pathways. Right? That means people really know what to do. If they have a symptom, what to do after that. And the hospital and the clinics know what to do after that. Okay? And then of course, collaboration. That one is known. You collaborate, you get better results. Okay? Health promotion needs to be done through frameworks, not just one-offs. Right? Like what we're doing now. We're just doing it all one-offs. And then of course, digitalization will help us get our data together, and therefore we can track our progress. Okay, let's move. So there are several research questions that I don't think I could really share with you because Rebong is, okay, we go to the next one. Maybe we skip this one, we skip this one, and we skip this one, and we skip this one. Okay, so this is what we did. The objectives of the study was a systems approach to cancer early diagnosis. And what we wanted was to find a solution that is very, very contextualized. We know what's happening with that community and we intervene in that community. And then we must understand the complex dynamics. And then we work together with our stakeholders to create change. You heard the word co-creation this morning? We've done it. So co-creation is a very important thing to do because when you are trying to change things, if your stakeholder doesn't want to, it will never happen. Okay, let's move to the next one. So this is the project. So we have about 7 sub-programs that is brought together actually because it was an interdisciplinary impact research grant. So we had to bring people from different faculties. So we had people from social sciences doing qualitative research on the social cultural barriers. Okay, that's Dr. Lai. And then we also have people who are looking at promotion, health promotion. Dr. Lee Yu Kong was actually in charge of strategic communication campaign research. We had a PhD student doing that. And then we had even PDPA legal experts because when we share patients' information across the health system, we need to be sure we are doing the right thing. Okay. And then we had training programs. So if you're in the other room, there are 2 programs being presented there. One is the primary care course and the other one is the community leader and cancer NGO navigation course, which we call Rakanku. Right, let's move on. So I think we just keep on pressing until everything goes there. Yeah, so we develop tools. So when we are doing implementation research, first you have identified the gaps. Once you've identified the gaps, you need to find strategies on how to implement evidence-based implementation. So what we did was we developed our tools. The Rebong tools, there are about 5 of them. So we had a training module for community leaders. We have a primary care short course for primary care doctors. And then we've got a community nurse course that actually looks at breast and cervical cancer. And this year we will be adding on colorectal cancer. Okay, because remember, people in the clinic kesihatan, I mean, they cannot think 3 ways, okay? They're thinking one person, what type of cancer. So we keep splitting up all the information and the education. It's not going to help our primary care doctors and nurses, okay? Then we had a strategic communication campaign where we developed materials. You can find them on YouTube, okay? And also we developed this optimal care pathway where we map and develop this sort of navigation pathway across, and we piloted in KK, Taman Medan and Hospital Shah Alam. Okay, let's go to the next one. So what we did was we tried to make things a bit more layperson. So this is the layperson version of what happens if you want to screen or you have a symptom of breast cancer. And then let's go to the next one. This is what it looks like for the doctors lah in the clinic. Like what they're supposed to do, and then if they send the mammogram off. So what happened was, to bring resources together, we can actually work with different ministries. You have Ministry of Women's providing the mammograms, vouchers, which are free actually, almost free. Okay, and then you have Klinik Kesihatan that is serving the most poor population in the country. Okay, but have no access to screening mammogram because if they refer them to the government hospital, not enough slots, right? So what we did was we brought the mammogram to KK Taman Medan. So the doctors in KK Taman Medan can refer for a mammogram in Beacon, and there is some communication happening in the back end. between the doctors. So it was a network of healthcare providers, and we had to take care of the PDP issues. So like Beacon Hospital, patients semua kena sign form lah. I agree that my results will be returned back to the hospital, clinic and all that. Okay, alright, let's move on. So this is how it looks like. So essentially, it is a way of communicating with the community, then bringing them close to the clinics, right? And from the clinic, there's a pathway to the hospital for diagnosis. And then you can see we have so many people, and some people here are actually part of it, Miss Wang, the Nadia, because every time we do campaigns, what do? We call all the cancer NGOs, because the resources are already there. Okay, we wish that we were a little bit more coordinated so that we could actually work together, right? So we tried it out. So we had a few projects. We had one in Lembah Subang, we had one in Masjid Jumhuriyah, and we had one in Kampung Cepaka, right? Okay, let's move on. So really, when you bring people together, so initially in the first year, we did Rakanku training for community leaders in this B40 committee in Taman Medan, but we found that actually they couldn't really manage. Because if transport is already a problem, can you imagine a B40 community leader trying to help someone in that community? So the next year, Rebung 2.0, we have invited all our cancer NGOs to be part of the training. So they're actually inside the training program, and they will have resources also. I mean, they also struggle lah. All our cancer NGOs struggle to find help for transport and all that. And then again, what if you connect them to the health system? So right now, we have Rakankus in Taman Medan who's trained and they know their clinic well now. So what happens, we have a cancer survivor, Kak Jamia. So she will now know, like if people in her community, if they need to go to the clinic, she can bring them, tell them what to do. Because most of the time, people find the clinic is very hostile. Susah nak buat appointment lah, macam-macam kan. So that is what the Rakanku does. And right now, Rakanku also helps with the communication campaign. Okay, let's move on. Okay, so this one are nursing programs. So nurses are one of the untapped resource in the country. And I think we have not been treating them very well. Okay, and they don't have support in terms of training. So what we did was we provided competency training. So we work with Know Your Lemons. So what they become are community educators. Any one of you, if you go to the Know Your Lemons website, you can train to be a global community educator, and you can be on their impact map. Oh, tengok ada tak impact map? Just go to the next slide. There's an impact map dah. So you can even write how many people you have trained. Okay, so all of you, please. I know Corinne. She's the founder of this wonderful thing. We should all teach people how to do breast examination and know how to detect symptoms. Okay, alright. So the nurses, you can see we have done training for quite a number of people in the community clinics, as well as the government hospital, and also the Ministry of Women's Hospital clinics. So you see, when nurses are empowered, they know how to network among themselves. So now nurses from MPPJ clinic now refer to LPPKN so that they get the HPV and the mammograms. And now the KK will be able to use the LPPKN vouchers in Beacon Hospital. Okay, so it was all about networking, creating pathways in the clinic. Okay, come, let's move on. So if you want to look at some of the developed materials, for the breast cancer part, we work with Know Your Lemons. So, I mean, you have to get copyright and all that, right? So we have an MOU with Know Your Lemons, and we've developed videos. The videos right now that we've uploaded are in Malay and Mandarin, but the English one for the breast cancer is there. But for Tamil and English for the rest of the others, is available maybe by June, because we're doing our next campaign by then. Okay, alright, let's move on. So when we did all these projects, we also wanted Rakanku to be involved in the communication campaign. So they were actually sending out. Remember, we were at the time where COVID almost ended, then we opened up, right? So during the COVID time too, we actually did what we call WhatsApp campaigns. Okay, let's move on. I hope the slides are in the right order. Let's move on. Doesn't want to move? Ooh, okay. Alright, so essentially we did a 6 weeks program, and we had different cancers that was exposed at every week. So the women actually shared with 7,000 over people their WhatsApp family, whatever. So you can see that the impact is there. They can actually reach a lot of people. if you reach the right people in the community. Because right now, cancer NGOs are like working so hard, but actually there are other people in the community that can actually also be part of it. Okay, because now, isn't it, all survivors and all that will do it, but then we need community leaders to put cancer into normal lives, you know. Okay, all right, so this is the last one we did, which was the Chinese speaking one. Okay, then we had very close collaboration with Jabatan Kesihatan Negeri Selangor. But okay, just to share with you, Rebung 2.0 is about a Mandarin-based community. We had the Taman Medan community, and this was the Chinese-speaking community. But it was difficult because this community is the Kampung Baru, somewhere in Kampung Cepaka. So it was not easy to reach out to the people. But now we know, if you want to do campaigns for this community, you got to be there at 7 a.m. Yeah, because they are out. They like to go out, kan? Fariza was on the project, Hamizah was there. So they will come at about 7. Tak sempat set booth, dia dah ada dah. So if you want to do this type of campaign, because they go pasar. So we must think like that. If you want to reach the people that you've not been reaching, look at what they do, okay? And try to do that. Okay, so that was the Chinese speaking one. And then we're doing another one in Kampung Sungai Way in June this year. Okay, move on. So one of the things we did was actually communicating all these findings to our colleagues in Jabatan Kesihatan Negeri Selangor. Because remember, Ministry of Health, they don't have enough resources. So I think the message today is so clear, we need to help them. Okay, so what we brought to them was a little ni. So let's just move on quickly. Let's move on. So essentially, okay, maybe we stop here. So what was the issues really in the clinic kesihatan? You know that we had a clinical breast examination policy for screening for breast cancer since 2014. Did anybody of you realize that? No, right? Because I mean, it was in the Ministry of Health, it was in the clinic kesihatan, they do millions a year. Okay, however, the target population for screening is only 5%. Because a lot of women that were examined were younger women, people going for getting in pregnancy kan, the check-up, post-delivery, right? So what we did was we tried to change that in the clinic. So from a 5% rate of target population, it rose to about 17.4%. It's nothing much lah, honestly. But it shows that actually you can shift. You can shift from just doing in those people to women who are older. Okay. So the other thing, if you notice, we had the mammogram screening in Beacon. So that year we started in June and ended somewhere in November. We had about 73 women in that clinic who decided to do the mammo lah, which is good. In 2023, we didn't have anything to do with Taman Medan. We didn't go there at all, but they were still sending women for screening mammogram. So it is sustainable. It could be actually practiced. So that's one thing. And then the other thing is, you know, for colorectal cancer screening, you can do what we call the IFOBT, fecal occult blood test. So in this clinic, with great campaigns happening in the clinic because they were so aware about this, the numbers tripled. So the IFOBT increased 3 times during that period, okay? But the problem with the increase in IFOBT is an increase in colonoscope. So 118 scopes, that is difficult to manage, very expensive. And then the hospital Shah Alam doesn't have enough resources. So for the coming ones, we are looking for CSR projects from neighbouring hospitals to help cover the colonoscopy processes. So we were working with Asunta, but it's difficult because doctors need to have, they need to be covered. What happens if there's a perforation when the colonoscope in someone on charity? It's very difficult, right? They might get sued and all that, so it's very difficult really. So maybe we should ask our quorum colleagues over there if there's anything available in terms of free colonoscopies, because once we start screening, this is what needs to be sorted out. Okay, so the other thing we managed to do was LPPKN does not provide free ultrasound for everyone who have a dense breast. When you do a mammo, sometimes you need an ultrasound to confirm things. So they only provide like 20% of the numbers. So we had to find, so Pink Ribbon Wellness Foundation was very kind, and they're still doing it today. They are actually sponsoring those ultrasounds in Beacon. Okay, all right, let's move on. Okay, let's move on. Let's move on. Okay, so what I wanted to talk about was that those were pilots that will end this year. Okay, but pilots is just a way of learning about the health system, how to coordinate and all that. So we are moving on to this project called City Cancer Challenge. So City Cancer Challenge is a global movement of cities with frameworks to help improve quality cancer care. So what they do is a situational analysis of the city, which we have successfully completed last year. We have about 21 hospitals in the Klang Valley that were in the situation analysis. And now we are developing what we call project plans. So the project plan is, I'm actually in the first thematic area, which is health system coordination and management. Okay, let's move on. So really, it is supposed to provide a patient-centered cancer referral pathway because we want to strengthen what we have now. Okay? And then we want to improve the timeliness of diagnosis and treatment of cancer. And we want to reduce the barriers to the diagnostic completion. Not everybody who has a positive screen gets their test done. Last time, I think a few years, data from Sari Selangor, which is verbally communicated, only less than 12% of people found to have a positive IFOBT actually completes their colonoscopy. So it is very low results. So this pathway is supposed to bring everything, the moving parts together. It's not going to be easy because one of the deliverables is actually looking at how we can digitalize that network. So this is almost like a pitch for any one of you interested to be part of this activity. We will be engaging somewhere in March to find partners. Okay, so what the city framework does is it helps project development, but they're very, very mindful about how industry will work together with whatever projects. So they have different milestones. So the first milestone is to bring people with no conflict of interest, whatever lah. That means no industry lah. So everybody sits together, figure out their roles in that project. Then after that, it will be open to industry for investment. So maybe there will be people who want to invest in paying for what? Maybe colonoscopes from certain private hospitals. Okay, so things like that. So it is still at the infancy stage. So we are open to anyone who want to be part of this team. Okay, come on, move on. So that's all. So please contact us. So that's my email. You can contact me. Or you can contact Derek. Derek is actually the city manager for Greater Petaling. All right, thank you very much.